I should start by saying that Selvi's spotlight is going international. Today we have with us Dr. Jacob Ristow, who is an orthopedic surgeon. He specializes in knee and shoulder. He's also assistant professor at the University of Minnesota. He's team physician for the women's basketball team. He's also assistant team physician for the men's football team. How do I know Dr. Ristow? So my son plays football for Prior Lake High School, and he recently tore his ACL. Dr. Ristow reconstructed his ACL and he did an amazing job with him. Not only that, he also patiently answers to all of my questions post-care. So thanks again, doctor, for agreeing to sit on this interview in spite of your busy schedule. And I also wanted to make it a point to say that being a physician, being a surgeon is probably one of the most gratifying jobs out there. They heal people. So super thankful for all of the physicians and surgeons out there. So let's go talk to him. Hello, doctor. Welcome. How are you doing today?
I'm doing well. Thanks for having me. Appreciate it.
Awesome. Thank you for agreeing to sit down on this interview with me, even with your super tight schedule. So appreciate it.
Of course, no problem.
All right. So first I want to begin with asking you, how did you decide to become a surgeon? Like, did you always want to be a surgeon, or is this something that changed when you're doing your undergraduate or anything like that?
Yeah, it's actually something that changed. So when I first went to medical school, I thought I was going to be a cardiologist or an oncologist.
Okay.
I don't really have anyone in my family who's in medicine.
Okay.
I didn't really have much experience with surgery or the OR. I think the nice thing about medical school is you don't really have to decide what area you're going into till your third or fourth year. And so most people find out pretty quickly if they have a surgeon or a medical doctor kind of mentality, personality, those kind of things, because they generally are very different personalities. I found out very quickly that I was much more of a surgical personality. And then from there, you kind of get to rotate through all the different areas of surgery during your clinical rotations. And orthopedics was a natural fit for me, personality-wise, and my interest. But it was definitely a change when I got to medical school from what the path that I thought I was going to take.
But did you always want to be in healthcare? Is that something you were always interested in?
Yeah, I think from the time that I started seriously thinking about what I wanted to do for a career in high school, that going to healthcare and more specifically becoming a physician was the path that I thought I was going to take. When I was in college, I volunteered in the hospital. I certainly explored other career opportunities, but ultimately stayed with my decision to go to medical school and then go on to become a physician.
Awesome. So I see that you are a surgeon. You are head physician for the basketball team. You're a physician for the football team. What else? Assistant professor for the university. How do you manage time? Like, how do you make time for all of these?
Yeah, that's a great question. I certainly, working for the university, I have a lot of opportunities to do things outside of just seeing patients in clinic and doing surgery. Some of them you mentioned. I'm the team physician for Gopher Women's Basketball. I'm the assistant team physician for football. I get to teach residents, things like that. I think that these are all parts of my job that I find very fulfilling. And in a way, I kind of volunteer to do them by taking an academic position. But certainly a lot of these things are nights and weekends, and it can be taxing on your time. Part of it is just in my personal life right now. I'm not married. I don't have kids. I have a lot more time than people who have families. I'm early on in my career. I certainly have partners who have busier clinical practices. That certainly makes things easier. But it can be a challenge at times, and you really do have to carve out time, very protected time, and often to have a life, have a personal life, do the things you enjoy. And oftentimes that does mean, going away for the weekend, vacations, things like that. We're not physically around to separate yourself from work, because being a physician, like many jobs now, is 24/7 work from home. It's hard to get away with email and text and those kind of things. I don't think that this is a challenge unique to myself in being a team physician or working at a university or even being a surgeon. I think all physicians struggle with this, of finding that balance, and especially because at the end of the day, we all want to take care of our patients and we all want to do what's best for them. And that oftentimes happens outside of normal work hours. So it can be hard for physicians to put that away for a night and focus on their family or their relationship or themselves.
Right. Yeah, no, I think you're doing a great job. You're able to handle all of this like simultaneously. On that note, like people like me who are outside of healthcare, and like most of my family, everybody is in IT, and we always think like surgeons, doctors, they're like working all the time. Like that's how I look at it. Do you take time for yourself? Do you go out on vacations? Like what is your time off look like? What do you do?
It definitely is a demanding career. I think medicine in general is an area that is evolving. I think that people of my generation value work life a little more than maybe a previous generation. And kind of the expectations in healthcare are evolving from more of an individual, you're a physician, you take care of their patients whenever they come in, day, night, holiday, to more of a team-based approach.
Okay.
I think that does allow you to have some time off, to actually go on vacation, right? And know that your partners will cover your patients and those kind of things. Certainly there is some choice too as to how much extra stuff you want to take on, how much extra call, those kind of things. Physicians will never be able to get away from working nights and weekends. Healthcare happens all the time and people need to be taken care of. But it is evolving to a career that is more manageable. I certainly take time for myself. I mean, during the weeks, I enjoy jogging, I enjoy working out, I enjoy spending time with my significant other, whether that's going out to eat, or doing something on a weekend. And I do get to go on vacation. I was actually just in India for 10 days for my cousin's wedding, which was a lot of fun. I take a couple long weekends a year where I get out of town, go visit family, visit friends, go to the beach, go golfing, things like that. So it's certainly doable. There are definitely careers that have more lifestyle, more balance. I definitely have a job where I work most weeknights. I generally put in 60 to 70 hours at least a week,
Oh, wow.
but it's something I enjoy. And there are a lot of people in careers outside of medicine, law, business, who put in similar hours. So,
Wow. All right, that's great to know. I had another question around like all of these different hats that you wear, being a professor, surgeon, being a head physician, and all of that. Is there any one of that hats that you wear that you would prioritize, or do you prefer one over the other, or like do you arrange it like in a certain order, like I love this over this maybe?
yeah, I mean, they're all part of the same job, right?
Okay.
Being a team physician is very rewarding. You have to have an operative clinical practice to take care of those patients, right? If they get injured and they need surgery, you have to be available to do it. Being a professor and teaching is just part of, having a job at a university system. At the end of the day, being a clinician, doing surgery, taking care of your patients comes first, ultimately. Your patient always comes first. And that can be very rewarding. And a lot of days, that's my favorite part of the job. It can also be very challenging. And a lot of days, that's my least favorite part of the job. But like any job, it has its ups and downs. I love team coverage. I love being a team physician, developing those relationships with the players, the staff, the family. It's a very different part of my job than everything else. And to be honest with you, a lot of days, that is my favorite part of the job. It also comes with its own challenges, but no parts of my job exist without the others. So they're all important areas that I have to do to have the career that I have.
Good to know. All right. Talking about challenges and gratifying things, like was there any type of surgery or anything that you found very challenging? Because when you did the surgery for Sid, I was like, oh my gosh, this is so complex. Like you literally took out tendon, reconstructed it to be an ACL. I'm like, it is not. I couldn't like understand like in my head that is so complex. But did you find anything very challenging like in your surgery? Like, is there anything that
Yeah,
you
definitely.
find?
I mean, surgery can definitely be challenging, and different surgeries have different levels of complexity. There are definitely surgeries that I do that are technically easier, they're shorter than others. And all that comes with experience and training. And there's a reason that surgeons train for 10 plus years after college. To be honest with you, those there are surgeries that are challenging, and I find them interesting and I find them rewarding to do. The most challenging thing for me, though, is not necessarily the surgery. Um, the most challenging thing for me is taking care of patients, especially patients who have complications. Surgery will never be without complication, and not every surgery has a good outcome. You could be the best surgeon in the world. You'll have some patients that don't have good outcomes who have complications. It's a part of the job. And it's incredibly challenging to take care of those patients, not so much because you don't know how to deal with the complications or those kind of things. It's just incredibly challenging to take care of a patient that you have met, you have done surgery with, you have gone into this social contract with, and they don't have a good outcome, and you feel personally responsible. And all physicians, we really care about our patients, and when our patients aren't doing well, we feel bad. It hurts us too. And that is the most challenging thing, is when the patients aren't doing well, you feel horrible for them, and it can be hard to compartmentalize that. And oftentimes all physicians carry that burden with them, and that can be a very challenging thing.
Thank you for saying it. A lot of people don't understand or think that surgeons are that empathetic to the patients. Like, it's more of like it's their job, but I feel the pain like the surgeons carry as well. So thank you
We
for
might not always
everything.
show it, but we all feel it. So
Yeah. Well, thanks again for everything you do. And then you briefly touched about the 10 plus years. So again, another question for people like me who are outside of healthcare is, how long do you study? Like, how long are you in school for? You are like college, and then you said you went to medical school, then you did your fellowship. Like, how long are you in school?
Yeah, absolutely. And this is a question I get a lot. Working at a university, I have a lot of undergrad students, high school students shadow me who are interested in going to medicine. And medicine's a great field. I would highly encourage anyone. I love my job. I wouldn't trade it. But it is a long road, and it's important to understand. So you'll have to go to 4 years of college, graduate with a college degree. You don't have to major in a biologic sciences, but you'll definitely have to do some prerequisites, and you'll have to do well in college because medical school is hard to get into. Medical school is 4 years. That's standardized. That's anywhere you go in the United States. And medical school will be essentially the same 4 years, no matter where you go and no matter what kind of physician you become. You have to go through the first 2 years, which are in classroom, and the second 2 years, which are clinical, which have standard rotations. At the end of medical school, you graduate, you're a physician, but you have to do a residency. To meaningfully practice in the United States, you have to do a residency. And this is the time that you specialize, right? The length of your residency depends on what area you're going into. For example, primary care physician is a 3-year residency, okay? Emergency medicine, I believe, is a 4-year. Radiology is 4 years. Orthopedic surgery is 5 years. Neurosurgery is 7 years. So it varies based on your specialty, and that's where you specialize. Okay, so you just work in your specialty, learning how to do that job for those number of years. You do get paid. You do not make a attending physician salary. At the end of that residency, you can then choose to just go on and become an attending physician, or this is a doctor as we know it, right? Go out, see patients, be fully licensed, make a normal salary. Or you can choose to do additional training, which we call a fellowship. Now, in my area, orthopedic surgery, most fellowships are 1 year. But in certain areas of medicine, like if you want to become a cardiologist or an oncologist, those can be 2, 3, 4, 5 years of additional training. Okay, these are optional. All right. So it can, I would say, at minimum after college, would be 7 years for some specialties to go through medical school and residency before you become a physician. But some people, if they go into very complex interventional cardiology, complex surgical specialties can be 12, 13, 14 years after college. At the end of the day, you have to go into an area that you enjoy, right? And just know that there's a reason the training is that long, and know that you'll do what you enjoy at the end, but it is something to be aware of when you're making that decision.
Wow, that's good to know. And is there a most gratifying thing of your, like the job that you do? Obviously, you save lives, or you, I think it could be the most gratifying job out there of all the jobs. But like, what do you think is the most gratifying in your role?
Yeah, I think every job can be very gratifying, and I think a lot of it depends on the person and what they enjoy doing, right? I certainly think that as physicians, we have a very gratifying job. And from my standpoint, it's definitely taking care of the patients, developing a relationship with the patient, seeing someone who has a problem and helping them through it. And that can be very different depending on what area of medicine you're in. I'm in a specialty that's very episodic. Someone gets injured, we do surgery, they get better. At some point, they just go back out and live life. But I have colleagues like primary care physicians or oncologists, psychiatrists who see patients long-term throughout their whole life for chronic conditions. And that's very satisfying in a very different way. Mine is very immediately satisfying, right? People do well, they get back to the sport they want to play. Their fracture heals, they get back to day-to-day life. But I have colleagues that treat people for their whole life, and they enjoy seeing patients over years get better or maintain control over whatever, disease they have going on.
Yeah.
At the end of the day, I think every physician will tell you it is the patient care, it is seeing patients succeed, it is being a part of that with the patient that we find the most satisfying. Like, I definitely enjoy doing a good surgery. I feel good about it after surgery. But it's seeing the patient outcome that is ultimately satisfying. And I think once you lose that, the other things, the pay, the respect you get in the community, those kind of things, they don't balance out the stress and the hours and everything else that comes with the job if you don't enjoy working with your patients and the gratification that you get with that physician-patient relationship.
Well said, beautifully put. We've talked about a lot of serious stuff. Let's talk about India. A lot of my viewers are from India. So is there any favorite place? Like you mentioned you went to Chennai and then you went to Kerala. How did you find India?
So I was actually there for a family wedding.
Okay.
So my cousin's wife is from Chennai.
Okay.
She came to the United States for grad school. That's how they met. They live in Brooklyn now. Okay. And so that's how I ended up going to India. It's the first time I've been there. So we were in Chennai for a week for the wedding. And then the second week we were there, we were in Kerala, we were in Kochi. And then we went to the backwaters. And it was beautiful. It's definitely a trip unlike any I've ever taken before, traveling that far. Having the time change and just having the cultural and language difference, it was really a great experience. But that's how I ended up going to India. It was an amazing time. It was awesome that I could go with my significant other, my aunt and uncle, my cousins, have a group of us there. But I had a great time in India. Kerala was beautiful, I would say. It was definitely my favorite part of the trip.
Yeah, it's one of the beautiful places there. How was the weather? Like did you go from like a -10 to Fahrenheit to like?
The day we flew out of Minneapolis, it was 7 below.
Okay.
It was in the 70s, getting up into the low 80s in Kochi, and it was mid to high 80s in Kerala. So It was definitely.
It's not bad.
Yeah, but comparison to what we left, I mean, we left in the middle of winter and went to, pool, beach type weather. So that was definitely a welcomed transition.
That's awesome. A lot of my friends here, they do enjoy Indian food, but they find it very spicy, hot in the sense, hot, spicy. Do you take spicy food or do you prefer more American?
Yeah, I do not handle spice very well. I'm
Okay.
definitely a Midwest Caucasian palate. Not to say that I won't try it. My body just doesn't handle it. I would say that when we were in India, um, I don't think that spice, the way we think of it in America as food being hot, like a pepper, was as much of an issue. There's always options. But I would say, in my experience, the Indian food was not as spicy as other areas, like we think like Mexican food or Thai food or things
Okay.
like that. It seemed to me when we were in India, when people would say spice, they meant more flavor as
Right.
opposed to more heat, um, which is not as big of a challenge for me.
Okay.
It was definitely fun trying different food. I would definitely say that my stomach was a little on edge the whole time I was there,
Okay.
and not because of I think the spice or the heat or because the food wasn't good. I think it's just such a different
Wow.
it's so different than what you're used to that your body is just not used to it, right? It's just the same thing if I had gone to Japan, Africa, South America. Is just such a different ingredients and things than what we're used to. If someone from those countries came here and ate McDonald's, their stomach probably wouldn't feel great either. So there's just a little bit of that. But I did have a good time trying all the food there.
That's awesome. Since you brought McDonald's up, when we were there, Sid would crave for a burger and we would like just hunt and then go find burgers, but that's absolutely like no burger place. Did you have that craving? Did you find anything like that?
Yeah, I definitely think you start to just crave what is natural to you,
Yeah.
right? What you know. I did go to in the airport in Chennai. I went to KFC because I just wanted to see the difference,
Yeah.
right? Because they have, I mean, there's KFCs, there's McDonald's, there's
Yeah.
all these, international chains, and definitely the the flavor and the menu is different in different countries to kind of cater to the people of that country. So that was very interesting. But I do think you start to crave what you're used to and those kind of things by the end of 2 weeks. So
Yeah. Sure. All right. So thank you so much for your time. This was very insightful. I have one final question
of
for
course.
all the youngsters that are out there who are aspiring to become surgeons. Um, any advice for them?
Yeah, absolutely. I get this question a lot too. So I would encourage people to consider medicine as a field, right? I think it's an incredibly rewarding field. It is certainly a field that will always have good job security. It's not going away as more and more people, as our global population increases. But I think like anything else, you have to have some experience in those kind of things. So if you're someone who's in high school, college, thinking about going into the medical field, I would encourage you to find ways to gain experience, right? Whether that's job shadowing, finding a job in a clinic or a hospital or things like that. Because I think you really have to get that experience, see what the different jobs and areas of medicine are like, and make sure that it's something you want. You may find that you don't want to become a physician, you want to become a physical therapist, or you want to become a nurse, or you want to become, um, a physician assistant. Whatever it is, these are all great jobs. You have to find what you enjoy, and they're all very rewarding, right? Before you start down a path of 10 years of training, you have to make sure that you enjoy that. With that being said, things that are going to set you up for success, certainly doing well in school is important, right? All of these careers require some kind of education and certification after high school, right? And getting involved in things that you enjoy, right? Whether that is you're in high school and that is playing sports for your high school, whether that's being in the band, whether that's doing forensics, student government, get involved, do things that you're passionate about, take leadership positions. These are things that will help you get into a good school. When you go to college, same thing, right? Everyone thinks that they have to do all this research in the medical field and being involved in only pre-medical societies. Get involved in things that you enjoy, that you're passionate about, right? These kind of things will shine through on a resume, make you a well-rounded person for whatever you decide to go into, right?
Absolutely. Great advice. And then finally, is there any significance of the number 23 right behind you, like the jersey?
Yeah, so this jersey was for my fellowship. I did my fellowship at the University of Minnesota in Tria, and as part of our fellowship, we took care of the the wild as well as all the gopher sports. So
Awesome.
when you graduated, every fellow got a jersey. 23 was the year we graduated, so that was the kind of the significance.
Awesome. So thanks again for your time and all your great advices and insights. I'll see you soon with Sid.
Sounds good. Well, thank you so much for having me. I really appreciate the opportunity. It was nice chatting.
All right. Thank you so much.